Hi, this is Peggy Earle with ETS Wound Care. I'm the clinical specialist, and today I'm going to talk about diabetic foot ulcer and how to address this, how to do some wound care with this diabetic foot ulcer. First of all, of course, we're always going to clean. I love this little sponge applicator. You can find these in any hospital. A little saline in there to dampen it, and then it's just a nice little scrubby. You can see this wound has a little bit of bone exposure there. Again, we're going to clean that in the peri-wound skin. Make sure we clean that up well. Going to blot off any excessive moisture. And you guys probably know that diabetic foot ulcers have a tendency to be quite wet, so we're not going to really worry about having excessive moisture. I really do want to show you how easy a wound of this size is to manage with a 1x1 application of MIRRAGEN. So this is a 1x1 packet, and as you can see, you just tear open the top of that. There's like a little file folder inside. I wanted you to see that. So there's a tab for you to grab so that you don't lose your product. It is a very small piece. Again, you can see that there are a lot of layers of this product. And so with a wound that's, let's see, that one is about 5.5 by 5. And of course, our main concern is the center of that wound because we're going to heal from the bottom out, right? I'm going to take a small piece and place it right on that exposed bone. And then from there, I'm going to separate out layers. And we're just going to place our layers in that central area. I have some little pieces left over here, so you can see that we can cover that wound very well with a 1x1, even though it's a significant size of wound. So again, if you think this is going to have sufficient moisture, then we're good to go with just a topper. I'm going to apply a 2x2 topper. Of course, if this were a real patient, I'd be looking for what kind of device or topping I could use that would give him some offloading. It's too big. And I love to manage this with gauze and occlusive dressings. It just works so well, and it's a very inexpensive way to manage this. With MIRRAGEN, you could think that should this wound be too moist, you actually could pull this topper off and replace just the toppers and resecure. And you really shouldn't have to manage this too frequently. MIRRAGEN does like to have a moist environment, so you could allow this to get a little wetter than you normally would a wound. But if you get a lot of strike through and patient's uncomfortable, of course, I would pull the tape away and the topper away and just replace them. If you would use a silicone border tape like this one, of course, then you can pull that away without causing any damage to the peri-wound skin or to the wound bed itself. And there you go. A 1x1 for about a 30 square centimeter ulcer on the heel. So that does it for this diabetic foot ulcer. Thank you very much.